first I want to comment on two stories in the news, because really on this show, I think it's going to be necessary to comment on the weekly news basically every week, because there's such a transformative time in the history of our country. And some of this connects to energy, but some of this connects to just freedom more broadly. And I want to say something about it. So just as I would want to say something when I think people were doing very wrong things in response to the stock market crash of 1929, just as I would have wanted to participate in debates during the Civil War, where people were advocating things that we now regard as reprehensible. So I want to participate in this discussion about what is the future of American freedom, including how does freedom relate to the current pandemic involving the new or novel coronavirus, aka COVID-19. So as you know, so that's one story I'm going to talk about, and then I'll more briefly talk about a story where BP, formerly British Petroleum, now sometimes likes to call itself Beyond Petroleum, or at least just BP, has announced that they are going to be 100% carbon neutral by the year 2050. So I'll talk about that a little bit, but I mainly want to focus on COVID-19. And in particular, at least one of the big news developments is that President Trump held a press conference on Sunday, and he talked about how he wants to extend what he would call social distancing guidelines, but really you can think of this as the indefinite universal lockdown, saying that the universal lockdown should be extended until the end of April. But then, and there were some models invoked in saying, well, we're already, there were going to be 2 million people who died, and now it's going to be maybe 200,000 or maybe less. So we're saving literally millions of lives doing this. This is the claim that's being made. I do not think this claim is actually a defensible claim. But then part of that is, we were relying on these models, and then so end of April. But then one of the leading people of the models said, no, actually end of May. So we are still in this state of indefinite universal lockdown. And it's a tricky issue to talk about, because we really, really, really don't want more people than necessary to die of what can be a horrific disease. It's not the only horrific disease, but it's the one that's captured our attention and has certain really scary properties, including how contagious it is. So I just want to put the proper weight on that. And then we see in particular locations, particularly in the United States, in New York City, we're seeing at least some cases of hospitals being overwhelmed, and that's really not a good thing. And we do not want that to happen throughout the country for all kinds of reasons. So there's every reason to want to take intelligent action to fight this virus, but in the context of what I would call human flourishing. So the goal of us and the goal of our government can't be prevent one virus, even a really bad virus, at all costs. The whole reason we want to prevent the virus is so that we can live our lives and enjoy our lives, what I would call human flourishing. You can think of it as we want a high quality of life. And so I think we need to think, and last week I talked about a path forward, which I called Don't Stop Living, Live Smarter. And I still want to be focused on that idea this week. But this week in particular, I thought it might be helpful to give you 6 filters that I use when I'm looking at different kinds of stories about COVID-19. And the reason these filters I think are particularly useful is because they're pretty hard to argue with, and yet they're violated all the time. And so what they can do is they can help you find some of the better experts and the better policymakers on this issue. And there are some who seem to be quite good. And there's one in particular that I will recommend as somebody I've found particularly insightful lately, at least with my current judgment. And I'm obviously not an expert on this particular virus. And in a sense, nobody is an expert fully on this particular virus and all the different aspects of dealing with it. But I do have a lot of expertise on thinking methods, and I can spot bad thinking methods. And I think there's some really obvious bad thinking methods. And I talked about some of them last week on the show. But here are 6 filters that I use that I think if you use them, it'll help you filter out most of what's going on in terms of prediction and policy as really bad, and then help you find some of the better thinkers, including some of the better specialists who have a lot of this specialized knowledge that I don't have and that you probably don't have. So it's really valuable to have these kinds of filters. So I'll just go through them quickly since we have a lot of other content to get to, but I think they'll be useful. And I'll put these filters each in terms of a question. And so each question will begin with "do they?" And if you just so when you're reading somebody, and this can be President Trump, it can be Dr. Fauci, it can be someone on CNN, doesn't matter, politics, what status, you can apply these filters. So filter number one is, do they assume that freedom of action means recklessness? Do they assume that freedom of action means recklessness? You see this all the time where people say, oh, well, if the government doesn't do something, then we're going to have all these deaths. And there's a whole bunch of aspects to that, I think, that are wrong assumptions behind these deaths, even if people were reckless. But there's no doubt that people being reckless will lead to a lot more deaths than people not being reckless, almost by definition. And yet there's this idea that unless we lock people down, then they will be reckless. And that is an assumption that should really be questioned, because there's every reason to think that given the proper information, many, many, many of us will act very intelligently, and that we'll discover all sorts of best practices that lead to much better outcomes, even just with respect to a virus, than this universal lockdown. And this leads to filter number two, which is, do they assume that a lockdown means optimal virus protection? There's this idea that, oh, well, if we lock people down, that's the best way to keep ourselves safe. And they're just some sort of intuitive things where that's obviously not true. Like if you're locking down elderly, vulnerable people with younger people, and the thing is asymptomatic, then you could be deliberately infecting people, and you could be infecting them under some of the conditions that many of the worst outbreaks have occurred under in terms of enclosed spaces. So that's just one of many things where it's not at all the optimal thing just to lock people down. And so when they assume that this is some sort of optimal virus prevention thing, there's something really suspicious with the way they're thinking. Filter number three, do they advocate universal measures for the highly vulnerable and the low vulnerability alike? Do they advocate universal measures for the highly vulnerable and low vulnerability alike? And I've stressed this pretty much every time I've spoken out about this, and because it's obvious, but nobody is talking about it. If you look at these lockdowns, you look at these orders, you look at most of these models, they're continually conflating high vulnerability people with low vulnerability people. And it makes absolutely no sense, because both the biggest risk death-wise and hospital overload-wise is people in very definable, vulnerable categories. There's some debate about to what extent young people are at risk, and I think that's almost all going to turn out to be in people who are very compromised in terms of their immune system. That's why I lump them under vulnerable. But if you take, say, healthy people, really healthy people under 50, that's just a totally different universe than, say, people over 80 or people with serious immune issues. So anybody who's making prescriptions and not making those differences is not a serious thinker, and there's some sort of moral thing, and I believe corrupt moral thing, justifying that versus it making any kind of logical sense. So that's do they advocate universal measures for the highly vulnerable and low vulnerability alike? I filter them out as a legitimate thinker on this issue. The fourth one is, do they equate diagnosed infections with actual infections? Do they equate diagnosed infections with actual infections? It is so outrageous what happens. And this goes to this statistic of the death rate. So the death rate means the real death rate of something is how many people die over how many people have it. So how many people end up dying over how many people are actually infected. And yet the way the death rate is usually calculated in all sorts of prestigious sources is it's measured by how many people die over how many people are diagnosed infected. And yet one of the whole attributes of COVID-19 is it is super contagious, in part because it is asymptomatic or invisible in a huge number of cases. And part of what we don't have really good knowledge of is how often it goes undetected. But there's really credible evidence that it's at least a 10-to-1 ratio, and that there are 10 asymptomatic, unreported actual infections for every diagnosed infection. And so if you say something like, oh, well, there's a 2% death rate, but you're off by a factor of 10, then that's 0.2%. That's twice the flu. But if you're off by a factor of 100, and there's evidence that some of these things are off by a factor of 100, then it would be something that's less deadly overall than the flu. It could be more deadly for specific people, but it might be less deadly on average. We really don't know. But nobody who's at all serious can just use these phony death rate statistics and calculate the death rate as the number of deaths over the diagnosed infections. And this is just being spread all over the place. It's the basis of models, and it just has to stop. So if you see somebody who is making these distinctions, then that is a good sign. And if they're not making these distinctions, that is a bad sign. And with all four of these things, somebody who I'm seeing consistently is not doing this is a guy named David Katz at Yale. And I don't know him at all, and I haven't seen him on other issues, but on this issue, he's written several things. I've looked at his LinkedIn page, and if you just search David Katz on Google, he has some really good stuff. And one of the most prominent things on his webpage is a set of public policy recommendations that recommends distinguishing among people by vulnerability. He gives different recommendations for people healthy under 60 versus people who are over 75. And that makes so much sense. And the fact that it's not being done, none of these lockdowns are saying anything specific about, oh, well, it should be a different policy for older people or younger people. Not that I think you should necessarily have a lockdown for anyone, but if you're having a lockdown for anyone, it should definitely be the vulnerable people, because the biggest concerns are the threat of their health, but even more, the biggest concern is the overload of the hospital system. So this is, and I found David Katz very helpful on this, and he's very clear about this point about the death rate and about we need better information about actual infections. And he's a big champion of collecting data from different places so that we can, what we would call randomized data. So just sampling a whole population, not just the people who come into the hospital for COVID-19, but everybody, including people who think there's nothing wrong with them or they just have a little cold, figure out what percentage of people in the country, or at least get a decent guess, what percentage of people in the country have it, because that's going to totally change your death rate. It's going to tell you how close is this to the flu versus how much of this is a difference in kind that really requires a different response. And I can't say one way or the other right now definitively, but I can say that the people with the lower estimates of the danger are the people who seem to be taking the actual infection rate seriously and seem to want to study it, versus the other people seem to just love dividing the number of deaths by the number of diagnosed cases in a world where we have a massive testing shortage and where we are overwhelmingly diagnosing people who are self-reporting as highly, highly symptomatic. Filter number 5, do they devalue freedom and quality of life? Do they devalue freedom and quality of life? A good friend of mine was observing the other day, said, when people are talking about this issue, they have this issue of they're talking about the lives saved versus the economy. And he said that, and I agree with this, that is a really false alternative, because one of the things that the economy just means individuals' productive activities. And the fundamental thing they do is they sustain lives, including they provide all these amazing medical cures that would not exist had we been living in a state of universal lockdown for a long time in the past. So there's this, it's wrong to think about, oh, well, saving lives versus the economy. But my friend in particular noted that there's almost no discussion of freedom as having any value. And that's wrong, I think, in many ways. I think the actually, in a sense, freedom should be the only value that we are talking about, because freedom is the means by which we flourish. It allows us to create and pursue the values we need to flourish, including rational decisions about virus protection, including things like cures to viruses that need to be produced with human ingenuity. So I do, my ultimate perspective is we should just be thinking in terms of freedom, and the government should only intervene if it can really prove that there's a contagion of the level where it is interfering with everybody's freedom, much as if we're invaded by a foreign country, that's a threat to everybody's freedom. So you have the temporary right to restrict activity in order to get rid of that violation of rights. But you have to think of it as the goal here is not to, quote, save lives, as if it's the government's job to decide how long people live or how long they should live, or should they, pursue their happiness and live a year shorter, or should they just exist on a ventilator for an extra year because the government wants to, quote, save lives. That's not the government's job at all. The government's job is to protect our freedom. And there's a question of, are there and when are there exceptional circumstances where this is truly getting in the way of our freedom in a universal way, where the government needs to act. And part of that is the government needs really, really clear standards of evidence to do that. And it does not qualify in my mind at all as a standard of evidence to say, well, we're going to hyperinflate the death rate, and then we're going to plug it into some models, and we're going to assume that human beings left to their own devices are stupid, and we'll just keep spreading this and contracting this and filling up hospitals no matter what happens. And so we'll keep what's called the R constant throughout this, and then it'll be exponential, and then 10 million people will die. Like that does not in my mind qualify at all as something that could justify, serious government intervention into our freedom. And if they say they don't have evidence, or they don't have enough evidence yet, then I think what you have to say is, here's what we think. We recommend that you do this voluntarily, but I don't think you can shut down people's lives because you say, well, we don't really know the state of this. So I'm rambling a little bit about that, or hopefully not rambling, but just going on to that topic of what I think the standard should ultimately be, which is the whole thing should be, how does the government protect freedom? But even if you don't have it as consistently, or as that is your ultimate standard politically, the way that I do, if people are talking about mass restrictions on individuals' ability to interact, which is an essential both of our productive ability, but also our ability to enjoy life, if they talk about the cavalier restriction of the freedom to interact in an indefinite way, if that is not treated as grave and even as a catastrophe, then this person does not care about human life. Even if they can say, well, look, I think this virus is so bad that we need to temporarily suspend those things, and it should really be temporarily. So I'm not saying whatever your evaluation of the virus, it should be the most solemn thing and an upsetting thing of what has been done to people's lives. And I just feel like it's so upsetting because they're just all of these lives being ruined. And I mean ruined in the sense of, or a better word is destroyed. People have built their lives. They've made plans. They've built restaurants. They've created events. And all of those are just been substantially destroyed. And people act like, oh, it's no big deal. And just do that, save lives, and without even much of a clear justification. Yeah, we're not even really sure what the evidence is, but here's an extreme catastrophe model. And so, yeah, that's perfectly sufficient to shut down your life indefinitely. With that kind of attitude, there's something deeply, deeply wrong morally, and I would say psychologically, with that kind of mentality. So that's a filter that I use. Again, I'm totally open to somebody who says, look, I think the virus is this bad, and so we have to pay this huge cost to fight it. I'm very doubtful of that given the evidence we have right now, but that at least makes sense. But if they do not care what is happening to the life of really now billions of people around the world, and that they're substantially being destroyed in ways that will compromise and hurt people's quality of life for years and years on end, and in some cases, the rest of people's lives will be negatively affected by this. If they don't care about that, and they just care about, oh, well, all that matters is extending the life, is delaying the death of already really sick people for 3 months, then I submit they're not concerned with life. It's more like they view life as living death. And that's a pretty harsh assessment, but see if you can come up with an argument against it. So this filter of, do they devalue freedom and quality of life? That's a really big one for me. And then finally, Do they treat the goal as eradicating COVID-19 instead of managing COVID-19? It's really important that we be clear on our goal at all times. And I think ultimately the goal has to be protect people's freedom so that they can flourish. That I see as the ultimate goal, the political goal, which enables the moral goal. So the political goal of protecting freedom, which enables the moral goal of being able to flourish, including being able to produce and including being able to interact. But within that, if you're talking about a virus, there is this question of, okay, are we trying to get rid of this? Are we trying to rid this from the earth? Is that the goal of our efforts? Is that how we're going to measure success? Or are we trying to manage it? Are we trying to make it more like the flu? If it's much more extreme than the flu in terms of its actual death rate, or are we trying to manage it so that it becomes much less deadly? I think that's a noble goal. And if eradication was really possible, I think that would be a great goal. But what we've heard over and over and over from the experts, and I haven't heard much contradiction to this at all, is that it's like the flu. It's not something we can eradicate. It's something that we can manage. And yet the government is treating this, it's saying, well, we want to win. We want to defeat this. And there's way too much of a conflation between eradication and management. You can say, okay, well, I want the rate of it to go down, or I want it to go, but even there, you have to be really careful, because the ways that people are saying, well, I want the number of cases to go down by this date. But if you're saying it's inevitable that 50% of the population is going to get it, then it might not make sense for cases to go down that much. And that if you're holding this false goal of eradication, you're using that as your standard, then you're going to compromise every other goal in service of this irrational goal. So right now, the evidence that I see, people who are talking about management, I respect. People who are talking about eradication, I don't respect, unless they have some fantastic argument as to how that's possible. Then I'm definitely open to it. But in particular, where people do not distinguish between eradication and management, they jump back and forth, that is a recipe for disaster. And it's not just a recipe for disaster, but disaster is being cooked right now. I think we're taught to think in terms of disaster as X number of people get this virus, but we're already having it be, hundreds of millions of people are having their lives deeply, deeply damaged. That to me is a disaster. Going into another Great Depression, which is a real possibility, that is a disaster. And even if it didn't decrease life expectancy, and it probably would, but even if it didn't decrease life expectancy, but it just made people more miserable for 10 years, I would regard that as a tragedy. And if people don't care about human happiness, then they don't really care about human life, because the reason we want to be alive is to enjoy ourselves, to be fulfilled. It's not to just exist for one more month or 2 more months, just to exist as in a miserable state. So those are the 6 filters. I hope that's helpful. Interested if any of you have any filters that you use. As always, if you have any ideas, you can contact me at alex@alexepstein.com.